they take more functions, like you feel they are more functional than they were prior to the surgery.
That's right, and they reach almost to normal breathing capacity.
And this happens sometimes like the kidneys, like when you remove one kidney, the other kidney takes over, and sometimes there are almost the function of both kidneys in that one.
That's correct.
This is amazing. Another question related to that from our viewers asking that, now you said it doesn't regenerate or doesn't regrow again. What about, you know, Dr. ضرار, now the new research everywhere worldwide about stem cell therapy and its indications. Is lung cancer one of the things that has been researched on, and does the stem cell therapy plays a role?
I think there are a few researchers for genetics, and some aspects of tumor surgeries regarding stem cells, but nothing really on the real ground now. It's only researchers, and I cannot really tell whether we can use it or not for the time being.
Yeah, actually we have another call from Mr. Saud in Saudi Arabia. Hello, good evening. Okay, we have it again. Yes, there was a question regarding now, like you said, it is all under research, so nothing is as confirmed to be used as a tool to regenerate lung tissue. We did mention that actually, and confirmed in other diseases and other conditions. So it's again all of it under research, and the minute we hear anything, of course, we will be announcing if there is any revolution or new treatments. Let's go further now, saying there are many patients who undergo for chemotherapy or radiotherapy sessions, and there are patients who do not go for such techniques. One of the questions was from Mr. Abdul Wahab, and there was another question also from another patient calling for that. Which patients go for that treatment? Are they the one who undergo surgical treatment, or not necessarily, or they are the late stage? What we can say?
Well, I have to stress on something. If the patient is a good candidate for surgery and the tumor is confined and it's resectable, then the best treatment is surgical treatment here.
Okay.
Now, if the patient, even if the tumor is resectable and the patient is not good candidate for surgery, that means that he cannot tolerate the procedure or the anesthesia, then there are other options other than surgery. For example, as you mentioned, radiotherapy and chemotherapy. So yes, the short answer is yes. There are some people who cannot tolerate the surgery or are not candidate for surgery. We transfer them for chemotherapy and radiotherapy. And those people, either they have multiple diseases, or the disease itself, the cancer itself, is actually advanced disease that's not amenable for resection, or it's so extensive that we cannot remove it all.
Okay, so this answers the question for those patients who've been referred for further treatment with radiotherapy or chemotherapy. It is for a reason, like you said, whether they were fear of there are some, like you said, not demarcated or not well demarcated or spread to the lymph nodes, or they were late presenter with late stage cancer, right?
Yes, that's correct. That's correct. And unfortunately, most people when they present late, more than 70%. They present late.
Okay. Now, what about the prognosis, Dr. There are many people now worried about survival rate. Am I going to survive after being diagnosed with lung cancer, regardless with the stage? Saying with the good news, with the earliest one, with the mildest form, and also with the latest. But let's start with the good news. Want to talk about the prognosis?
Right. If we have what is called stage 1 lung cancer, and it's really confined to a specific lobe or a specific area of the lung, and remove the whole lung, it's called stage 1, and there is no lymph node involved here. The survival is actually more than 75% or 80%, and we're talking about 5-year survival. Doesn't mean that the patient will die after 5 years. But
this is the average survival rate.
Those are most of the researchers. They try to study the patient and follow the patient for 5 years, and after that they are on by own, basically.
Yes.
So the good news, stage 1 disease is treatable, it's curable, and a very, very good survival rate.
Okay, and as you go further in the stages of that disease, then the survival rate actually goes down.
Will
This is
decrease,
logic.
definitely will decrease.
Yes. We had a call, and there's a question, Dr. ضرار. We have many calls I cannot
Sure, no
follow,
problem.
but one of the questions, many people were curious. Okay, you talked today, we've met Dr. ضرار. He's a consultant thoracic surgery. You are talking about lung cancer and pneumothorax, which I know my time now, or our time doesn't allow, so you are booked for another episode.
Sure, absolutely.
They say, can you tell us, please, an example of what a thoracic surgeon can offer as a treatment, or what cases he can manage? So why a thoracic surgeon should have care about such cases and not other surgeons? We want to emphasize this tonight. And this is a very important question.
It is a good, actually, it's an excellent question.
Yes.
Most people, they don't know what's thoracic surgery.
Exactly.
And,
even some of our colleagues, actually, they don't know when to refer.
To make it simple, thoracic surgery is a surgery that's limited to, well, not limited to exactly, but that concerns about anything inside the chest. So, for example, we deal with pneumothorax, we deal with lung cancer, we deal with mediastinal cancers or tumors. We deal with any disease that affects the airways, that's tumors or
I have to interrupt you again.
Sure,
Dr.
no
there is a call from Mr. Nasser from Kuwait. Good evening, Mr. Nasser.
Good evening, yes. My question is to the doctor with regards to paraneoplastic syndrome that's associated with lung cancer. How is it treated?
Okay.
And is it curable?
Okay, that's a good question. Thank you, Mr. Nasser, for calling. Yes,
that's an
briefly,
excellent
if you
question.
answer
That's an
so
excellent
good.
question. I mean,
Yes.
People who knows about paraneoplastic syndrome are usually medically oriented.
I suspect he's a doctor.
It's probably most
Maybe a
probably.
professor.
Right.
Okay.
Yeah, some of the paraneoplastic syndromes actually they fade away whenever you take the lung cancer out. For example, some people they present with bone pain associated with lung cancer.
Yes.
The moment you remove the lung cancer, next day they are basically
free of pain.
Yeah, they're free of pain,
Yes,
and I've seen
yes.
this actually in many cases.
So this is peculiar for that specific condition that Mr. Nasser have asked about.
Yeah.
And Mr. Nasser, if you have further questions that you like to ask, please send us on our email. Dr. ضرار will be more than happy to answer you on them. Now, unfortunately, like you see, Dr. ضرار, we are approaching the end of our episode, and as I expected, I didn't expect that we'll be able to cover both topics. So you are booked, if not the next week, dear viewers, the week after, hopefully, if you are free to finish with the topic pneumothorax. But briefly, at the end of this episode, what would you like to give us as a final message to our doctors or viewers?
Well, the most important message is you have to know that smoking is #1 killer. Smoking is not only harms you, it harms whoever around you, your beloved, your colleagues, everyone that is really you really concern and you really like. So my message is stop smoking as soon as possible.
And this is a very golden message from you, Dr. ضرار, on the behalf of everyone here tonight, from our crew and our viewers. I cannot thank you enough for coming tonight and answering the questions and informing us about such important topic. But also I would like to announce that you are booked with us in the coming future or coming weeks, whether next week, dear viewers, or the week after consulting with Dr. ضرار according to your schedule to cover the other topic, pneumothorax, which is very important. Thank you again, Dr.
Thank you very much. I'll be more than pleased, and I thank everybody here that you've been great and very professional.
Thank you very much. Dear viewers, let's have a final look on our email and fax for those who are still calling to get your question. Breath is life, so take care of your lung. So this is a message to live a healthy life with a healthy lung. Good night and see you next week.